Mr. President, according to the National Institute of Mental Health, approximately 1 in 4 adults suffers from a diagnosable mental health disorder that could be treated if diagnosed properly and treated properly. The bill that the chairman brings to the floor today, the bill that establishes the so-called doc fix, the repair in a reimbursement issue, has an important provision in it that allows us to look at those individuals that have these mental health behavioral illnesses and begin to treat them in 8 pilot states like any other illness. When Senator Stabenow and I introduced the bill, the Excellence in Mental Health Act, in February of 2013, our goal was to be sure that federally qualified centers, that behavioral clinics that met, mental health clinics that met the proper standards could offer mental health treatment like any other kind of health treatment. What this bill that we'll vote on later today includes is a provision that takes that legislation and allows the country to have a 2-year pilot in 8 states. Those 8 states aren't designated in the legislation. The states themselves would step forward and say they wanted to be part of this. Certainly when we introduced this legislation in February of 2013, supported from the very start by Chairman Wyden, who's just become chairman of this critically important finance committee, we did it looking at the reality that people's lives are changed and the people that they impact are changed. You know, one of the things that moved the Senate toward talking about mental health were some of the violence tragedies we've had in the country in recent years. In fact, after the Sandy Hook tragedy in December of a year ago, we had a hearing, the committee that deals with these issues had a hearing on mental health in January of 2013. It was the first hearing on mental health since 2007. For whatever reason, these are issues that as a society we haven't wanted to deal with in the way we could. Now, as I mentioned, violent tragedies, I'd want to be sure and say that people with behavioral illness are much more likely to be the victims of the crime than they are to be the perpetrators of a crime. But even when saying that, we know that the one consistent thing in these tragedies over and over again in this country or other countries is somebody that has a behavioral illness that hasn't been dealt with. Somebody has a clear need that no one has reached out to meet that need. In pursuing the Excellence in Mental Health Act and now pursuing this pilot project for 8 states, the law enforcement community has been widely supportive of dealing with these challenges where we can deal with these challenges at locations that people want to go to create maximum accessibility and fully qualified locations. The veterans community, unbelievably responsive. The Iraq and Afghanistan veterans community was in Washington last week. Dealing with mental health challenges was their #1 priority. And we just had a news conference here in the building, and somebody from that group was once again with us, as they have been since February of 2013. The community that supports mental health and looking for mental health solutions has been widely supportive of what we're trying to do. The House passed this legislation. It's legislation that we worked on, House members, Senate members, bipartisan. One of the House members, Dr. Tim Murphy, a psychiatrist who understands these issues. We have a special, not only was he supportive of what we were doing, but we became supportive of what he was doing when he was advocating that for people who have a behavioral illness, people who have a mental illness, who are involved in a nonviolent crime, that dealing with their illness rather than incarcerating the individual is the better approach that should be available to law enforcement, to judges. That's an important part of what we're doing here. The Excellence in Mental Health Act was originally co-sponsored by a bipartisan group of 25 senators. It's been supported by 50 mental health organizations, veterans organizations, law enforcement organizations. It's a place where, it creates a place where people's needs are met. The demonstration project would allow community mental health centers an opportunity to increase the kind of services they provide within and to their local communities by providing a similar rate under Medicaid that federally qualified centers receive for primary care services. This is something we've been talking about for a long time, and it allows government to begin to treat these behavioral challenges exactly like we treat other challenges. To have a healthy body, a healthy mind, all in one person, all in one spirit, all treatable. But this provision in this bill that comes before us today, I think, is the beginning of a significant change in how we look at helping people change their lives, the beginning of a significant change in looking at mental illness like it's any other illness. I believe we're going to see a good response to this on the floor today as we vote. More importantly, I think we're going to see a number of states who are incredibly interested in being one of these 8 pilot states that will allow that to happen. Missouri, I certainly hope, turns out to be one of those states, and I would say that clearly our state has been a leader in so many things: mental health, first aid. Many of our federally qualified clinics have added behavioral health. Many of our community clinics have added a level of service that this law would anticipate you'd need to have to meet community needs. I've certainly worked closely with the Missouri Coalition of Community Mental Health Centers. They just celebrated their 35th anniversary, and they're very excited about this legislation. Senator Stabenow and I were on the floor the last day of October, the 50th anniversary of President Kennedy signing the Community Mental Health Act. And many of the goals of that act have not been achieved in the way that the country, I believe, 50 years ago would have hoped to see them achieved. But this legislation today includes a significant step toward that goal set half a century ago, still unrealized, that allows us to do things as a country that we wouldn't otherwise be able to do. I would say that Senator Stabenow has been a great partner in this legislative effort, a great advocate for this effort. Our bipartisan friends in the House have as well, and I look forward to a successful vote today so that we can see this important step forward. And I would yield the floor.